Okay, so our project is a pandemic within a pandemic. It's about sexism, COVID-19, and domestic violence rates. It's by Madison Ultersdorf, Hadley Bruns, Jaden Frost, and Faith Gooch, and we are part of the social work program. So, our abstract: in society, there's a clear line between the roles of women and men. These roles have a direct effect on the discrimination and oppression of women and how women are the main target of domestic abuse. Domestic violence against women is an age old phenomenon. Women have always been considered weak, vulnerable, and in a position to be exploited. Violence has long been accepted as something that happens to women. While men also experience domestic violence, women make up majority of the victims. In recent years, the world has been dealing with a nationwide pandemic because of the coronavirus, also known as COVID-19. In our studies, we found that COVID-19 has had a direct effect on victims of domestic violence, as there have been state emergencies and stay-at-home orders leading to lockdowns and isolation, which cause people to quarantine and be isolated with their abusers. We look at how the rates of domestic violence in previous years have increased compared to recent studies. As social workers, our focus is to help women make a plan during a time when things are still shut down, so that the rates of domestic violence can decrease and more victims can be helped. And our references are Kaur and Garg, 2008. So the background and purpose of the study. So sexism is the belief that one sex is superior to or more valuable than another sex. And the term sexism emerged from the second wave feminism of the 1960s through the 1980s and was most likely modeled on the civil rights movement's term racism. And so feminism is most commonly applied against women, and it functions to maintain patriarchy or male domination through ideological and material practices that oppress women. So domestic violence is the pattern of abusive behavior in any relationship that is used to gain or maintain control, whether that's physical, sexual, emotional, psychological threats, and etc. On March 9th, 2020, Ohio was put under a state of emergency after 3 people tested positive for the coronavirus. On March 22nd, the Ohio Department of Health issued a stay-at-home order. And during the first few months of COVID, domestic violence fatalities were 14% higher than during the same period in 2019. The purpose of our study is to understand how COVID-19 has had an effect on the rates of domestic violence against women in quarantine.
For our method, we compared domestic violence to other states in the United States as well as other countries. We also looked at statistics for Ohio. We wanted to see how COVID-19 has affected domestic violence rates on women, while also studying what social workers could do on the micro, meso, and macro level. Our hypothesis: COVID-19 has a direct effect on the increase in domestic violence rates against women, and our target population were women and men. For our results, we compared the arrest in domestic violence and the calls to domestic violence hotlines prior to COVID-19 to now. Following the stay-at-home order, Portland Police Bureau recorded a 22% increase in arrests related to domestic violence compared to prior weeks. The San Antonio Police Department noted they received an 18% increase in domestic violence compared to March 2019. In Jefferson County, Alabama, the Sheriff's Office reported a 27% increase in domestic violence calls during March 2020 compared to March 2019. And lastly, during the month of March, the New York City Police Department responded to a 10% increase in domestic violence reports compared to March 2019. In the chart below, it shows different countries affected by domestic violence, and these countries include Colombia, Chile, Argentina, Brazil, and Mexico.
Okay, this research shows how people around the world are being affected by domestic abuse due to being stuck inside because of the coronavirus outbreak. We utilized previous research to show how domestic abuse rates have risen from before the coronavirus to now when we are still experiencing it. Our next steps are sharing our findings and helping people realize how bad domestic abuse has gotten since the pandemic. We can also share how people around the world can try to help victims of domestic abuse. One study limitation we faced is that there is little information about the coronavirus published because it is ongoing. For micro practice, we can work one-on-one with clients to devise a plan. For meso practice, we can work in women's shelters and help them get to safe houses. And for macro practice, we can improve hotlines by creating COVID and domestic violence hotlines. To conclude, the rates of domestic violence have increased due to COVID-19. The given statistics prove the increase in domestic violence against women in Ohio, the United States, and in other countries around the world. COVID-19 and quarantine has changed the resources we have access to, and women have less access to help in regards to domestic violence. As social workers, it is imperative that we advocate for and work with women who are victims of domestic violence and help create to provide resources for those women in need.